So if any of the things which I'm going to talk about tonight should trigger some unpleasant feelings amongst any of the people who are present, um, just be aware that the whole point is about sharing information and signposting and raising awareness about some mental health issues, particularly in this difficult time of COVID. So just be aware that you're not alone. There are a number of people that you can contact if you're feeling particularly suicidal or would like to get urgent support. If you're in the Northamptonshire area, we do have, in addition to the 999 emergency line, a 24-hour mental health line that you can call. And you'll be able to speak to a mental health navigator who will direct your call. The number is 0800 448 0828. If at any point you've not had a chance to capture that number, if you Google Northamptonshire Healthcare NHS Foundation Trust and just search mental health line on our website, you'll be able to find this. So if you're in the Northamptonshire area, if you are a carer of someone who's got mental health problems, or you're struggling with mental health difficulties yourself and you would like some urgent support, that is a number that you can call. Just in terms of mental health problems, we've certainly seen a surge of people complaining of mental health problems since the COVID pandemic began. So pre-pandemic levels were around 10% of adults reporting symptoms, but by June 2020, this has risen to about 19,000. When our mental health line was established, we were sort of anticipating we'd get around 40,000 calls a year, but that's actually increased to almost 100,000 calls a year, and it's just a combination of a number of things, really. One, people being aware of the line and making use of it, which is a good thing, and another, which is actually the kind of prevalence of mental health problems going up. And this is a slide that just illustrates, the predicted increase in mental health problems. So we will see probably, a reduction as people sort of get used to, the pandemic, as some of the restrictions ease, and obviously some of the social isolation which has been associated with the COVID pandemic starting to reduce with restrictions lifting, etc. But by far, the most common causes of mental ill health during this time has really been around grief and symptoms of low mood and depression. And some of the specific presentations have been, around mild, moderate, or severe depression, sort of postnatal, or which is post-birth low mood, postnatal depression, that is, and some of the other associated diagnoses have been bipolar, which used to be called manic depressive psychosis, but is actually called bipolar affective disorder now, and a seasonal affective disorder, which is low mood associated with the cold, dark winter months. For someone to call it depression, there are a few things which one must look out for. One is the obvious, low mood, but there are some associated symptoms which, people do need to be aware of. for you to sort of start thinking about a possible diagnosis of depression. And these include feelings of hopelessness, being tearful, unexplained guilt, feeling less tolerant of other people, and potentially being irritable, feeling anxious, finding it difficult to make what used to be straightforward decisions that people made in the past, and also sort of starting to lack enjoyment in what were previously pleasurable activities, and we call that anhedonia, and that's what this is. So there are some associated physical symptoms, with depression, and this includes, really reduced speech and movement, changes in appetite. So you can have a reduced appetite, and in some cases, people may find comfort in eating, so an increased appetite with increased weight. So some people might have, a sudden decrease in weight, and some people might have a sudden increase in weight, and both can be associated with depression, depending on how the individual responds to it. There can be a lack of energy, reduced sex drive, changes in the menstrual cycle, and a really big one is disturbed sleep. Some people may find it very difficult to fall asleep, and they call that insomnia. And some people may find it, that they actually increase their need for sleep, and they call that hypersomnolence. So some of the social symptoms, and I don't know if people will recognize this, avoiding contact with friends and family, having fewer social contact. And if some people used to enjoy certain interests and hobbies, they start to sort of shy away from those things, having difficulties at home, at work, and in the family. And sometimes this is very important for us if we've got colleagues in the workplace who we find have got a bit of a change of personality, which has just come on, to sort of inquire a little bit more. And it's also important for us to be more tolerant of people who are going through these periods of withdrawal, because it's okay not to be okay, and it's important for us to look out for each other, whatever the workplace is. And sometimes people take make light of people in certain professions, that some people who are in a caring professions are somehow immune to having mental health problems, and actually it's important to recognize that people who are in a caring profession can sort of succumb to some of these symptoms of low mood, which are based on prevailing conditions. So usually the treatment of depression is talking treatments, and we call that cognitive behavioral therapy. One of the most effective ways of accessing cognitive behavioral therapy is through self-help. It can be computerized, or it can be through books. One of my favorite texts is a book called Mind Over Mood, which takes you step by step on being able to recognize how your emotions, how your physical health, and how your mental health interact with each other, and what steps you can take to actually get yourself out of a rut. Medication is not necessarily the first thing to do, and we must be careful about the medication that people take. Consult your GP, and usually if symptoms persist, for about 2 years, and some of the non-medical ways, of addressing these symptoms prove to be ineffective. So medication can be considered in those cases. An assessment by the GP and other qualified mental health professionals can advise that medication is prescribed quite early on, particularly where there are those physical symptoms of depression, which I mentioned earlier, and if they are associated suicidal thoughts, increased risk, reduced levels of functioning, which are affecting the sort of global presentation of the individual. Medication can be indicated then. One of the things that I want to talk about, which has been associated with pandemic, is trauma. So there's a difference between just trauma and post-traumatic stress disorder. And I think we just need to sort of define what trauma is. And simply put, trauma is either a physical or emotional injury. And traumatic events can be psychological and physical, or they can be physical. Typically, they're unpleasant occurrences which are unwanted and very significant. And significant is relative, depending on what I would describe as the mental strength or the resilience of that individual. So what might be significant to one person might not be as significant to another person, but we need to just be cognizant of the fact that what affects an individual and how that affects that individual is important for us to bear in mind. I often use this analogy to sort of illustrate how a traumatic event can be something that someone can get over, depending on their levels of resilience. But if a traumatic event is so significant, that it causes the individual to snap. Like if it's and if you think about the brain as an elastic band, if you like, if you stretch an elastic band a little bit, it'll regain its original form quite easily. If you carry on stretching it, it might start to not regain its original form. But if you stretch it too far, it will snap. And the same can be considered about the brain. So there are certain chronic effects on the brain which will lead to certain changes in the brain. There are certain chemical transmitters which are involved in responses to either trauma or stress. And some of these chemical transmitters include what are called steroid hormones or glucocorticoids. When you are in a particular state of stress, those, the production or increased levels of some of these chemical transmitters goes up. And that can have, various impacts. If it's in a child in the developing brain, that can lead to, either shrinkage or structure, what we call structural changes to the brain. The brain doesn't, a developing brain which is exposed to a lot of trauma doesn't grow as well as one that is, exposed to a sort of normal childhood and development. And so studies have shown that there's a 6% reduction in the size of the brain for a child who is maltreated. There's a particular area of the brain which is responsible for learning and memory, which is called the hippocampus. Hippocampus is simply means small horse. It's an area of the brain which is shaped like a seahorse. And this is where you would find it in terms of where the brain is, and it's It's important in the development of memory and learning. And that area of the brain, if exposed to repeated trauma, is likely to have a reduced level of development. So what we call adverse childhood experiences can lead to a number of different difficulties for children. One, it can expose one to increased levels of injury, depression in later life. There is an association with unintended or childhood pregnancy. There is an association with increased levels of infectious diseases. Remember that chemical transmitter, which I spoke about, glucocorticoids, those can, increased levels of those can lead one to have a reduced immune response. So things like infectious diseases tend to be higher. The resilience of the individual in later life can be reduced, leading to risky behaviors such as increased alcohol and illicit substance consumption. And like I said, with a 6% reduction in the size of the brain, that can lead to reduced educational attainment in later life. So adverse events, or adverse traumatic events can have a massive impact on the developing brain. So like I said, there's a difference between trauma and post-traumatic stress disorder. Not all traumatic events will lead to stress or will lead to, what we call sequelae of trauma. However, in a minority of cases, some people will develop a disorder which is due to extreme reactions to threats and horrific events that have happened in the past. And the features of this can be the re-experiencing of those events, avoidance of situations that might lead to traumatic events, and a general heightened perception of threat. And those are the key features of post-traumatic stress disorder. The predisposing factors may be the personality of the individual and history of anxiety, and the causes can be chronic abuse, physical or sexual assaults. And why I mention this is that during the pandemic, during lockdown, there was a particular situation that sort of occurred amongst families where people had to stay, in their households for long periods of time. And for some individuals who were in particularly difficult, home environments, there was an increased a surge of, physical and, sexual violence and domestic violence. And this led to a high level of, post-traumatic stress disorder amongst people who experience such difficult conditions. So the other thing that happened in the pandemic was, the increased levels of, death and loss. And that was experienced as both, a physical trauma that the body will have gone through for people who suffered from COVID and recovered from it. Some people who then experienced long COVID with, that the physical impact that would have had them, and the people who lost very close loved ones and or didn't have a proper opportunity to grieve. So the sort of symptoms of post-traumatic stress disorder include flashbacks, that state of hyperarousal, hypervigilance, anxiety, insomnia, having nightmares, insomnia, which is lack of sleep, a state of emotional detachment from other people, lack of enjoyment of what was normally pleasurable activities such as if you enjoyed a hobby or something like that, and then suddenly found yourself in a situation where you couldn't enjoy such things. That's anhedonia, which is a feature of a post-traumatic stress disorder, and can also be a feature of depression. So this is a bit of a busy slide, but I won't dwell too much on the different guidance for treatment of post-traumatic stress disorder. I think the take-home message for me is that talking treatments and specifically trauma-focused cognitive behavioral therapy is the mainstay of treatment of PTSD. There is a role for medication, but that's usually assessed on an individual basis. And it's usually determined on a stepwise approach. So if you have any or recognize any of these symptoms in yourself or in someone who you've come into contact with, please be sure to sort of advise them to seek professional help by consulting their GP, who can make either onward referrals to a secondary mental health services and give that individual access to the psychological treatment which they need. I will stop there and I'll stop sharing these slides and I'll just open it up to colleagues to ask questions, and we'll take it from there. So the impact on the developing brain is permanent. And that kind of, a 6%, reduced size of the brain becomes permanent. So this is the importance of us, as much as possible, reducing, the adverse effects, of trauma on children. So adverse, life events in childhood have a really permanent impact. You can with treatment, build up some of the resilience that people have. And if you recognize the effects of, adverse childhood events quite early, then you can intervene. But the structural changes are unfortunately not reversible. So if you think about how the developing brain is like, initially you will have what are called brain cells or neurons. And with those neurons, how your brain develops is by developing connections with different, parts, of or other brain cells in the brain. And that's how you develop the memory. That's how you develop your ability to learn. And that's how you develop your knowledge. And if we were to say, look at a microscopic image of a childhood brain at 2 years and looked at one at 8 years, and if we looked at the same brain cells, if you like, the number of connections between the 2-year-old brain cell and the 8-year-old brain cell is significantly higher. So as you're growing, you are acquiring all those connections. But if you are subject to constant injury and that constant threat phenomenon, where those chemical transmitters, which I was talking about, are being secreted or increased within the brain environment, the growth of all those connections is reduced, and there comes a point where your ability to make those connections is not as fluid as it was when you were much younger. And so your level of attainment becomes static after a certain point. Interesting question. And various people have looked at it in various different ways. So one is to say, because the number of referrals that were made and our ability to sort of respond to referrals through kind of telephone interviews meant that we could respond to more people than we could. In some instances, access to mental health services was a lot quicker than it would have been. What we did find, however, was that just the type of presentation was a lot worse during the during the COVID pandemic than ever before. So, for instance, with things like psychotic disorders, where people would have something like schizophrenia, where they would have paranoid symptoms and things like that. I certainly found, and it wasn't just anecdotally, I certainly found that the number of people that needed to be admitted under a section of the Mental Health Act, the type of symptoms that they were experiencing at that time was certainly higher in terms of frequency and intensity than pre-pandemic levels. And a lot of that will have had something to do with, what was going on social media. So rather unhealthily, there were lots of conspiracy theories about the pandemic, where it was coming from, concerns about things like the vaccine, et cetera, et cetera. So, people were not going out, and suddenly their only contact with the outside world was through the internet. And there was a lot of information on the internet. And for people who were vulnerable to that, misinformation, their levels of paranoia tended to be a lot worse. One other thing that happens, human beings are herd animals, and we thrive from having social contact with other human beings. So if you think about, a lot of, elderly people who, by virtue of them, having certain long-term conditions and, being on the kind of shielding list, had to actually self-isolate for long periods of time without contact with their close loved ones. Those individuals will, have been more prone to sort of mood disorders and, depression, etc., because they didn't actually want to have that physical contact with other people. We know, that having physical contact, whether that's, hugging someone, kissing, or whatever the case may be, or family, in a non-intimate way, I must add, it does actually have an impact on one's well-being. So inability to do things like that will have had an impact on things like incidents of depression and low mood. I would first of all want to go by the kind of nice guidance for depression. So what I would recommend, as a medical professional, is, the first line for depression is cognitive behavioral therapy, which I mentioned, and that can be either sort of self-help or facilitated by a therapist in IAPT, for instance. Those are the forms of treatment, which are based on, scientific evidence, randomized clinical trials, which have shown that there's evidence for that. Now, having said that, one of the things which is quite obvious is that some people will find that inner peace through meditation and will benefit from that. I can't say that there have been sort of what you would call head-to-head clinical trials comparing, what's better, meditation or cognitive behavioral therapy versus, medication. But certainly things like mindfulness have been shown to improve one's mental well-being and are, certainly useful ways of improving one's mental health. I wouldn't go so far as to compare the different types, of treatment, but there is benefit from those modalities. So the kind of traditional, nice guidelines, are what I would recommend, and what I would, in my profession, given my my need to always recommend things which have got scientific evidence behind them. Those would be my first line, and in terms of treatment. But I am not in any way, shape, or form saying that there haven't been demonstrable changes to people's well-being from engaging in certain things. Certainly, other non-medical ways of improving one's well-being, such as exercise, have actually been shown to improve moods, and there is a scientific basis for this. So one of the things which we have noticed, and I think population studies will show us this, in the future. Certainly, our children have been disadvantaged by not being able to go to school for various reasons. For some of these children, the home environment might have been a troubled one, where there might have been increased levels of domestic violence, etc. And if you look at some of the things that I was talking about earlier, about how, increased levels of threat and trauma can impact on the development of the developing brain, that will have had a significant impact. The other thing which is very, very significant is physical activity having been reduced in children during this time. So not being able to play sport and interact with other children has been very, very difficult for some children. That will have an impact in terms of the development of their social skills, and again, children can bounce back, but I think certainly what's happened will have had an impact, on them. Just generally being able to cope with increased periods of stress around exams, again, is another issue. It's funny, the fact that our children couldn't do, exams and be exposed to exam conditions quite early on, in some cases might have an impact on their ability to cope with that level of stress in later life, like in university or in the work environment. And whilst, those kind of structured teacher assessments, have been a reasonable substitute. But there's also something about, remember that elastic band phenomenon that I was talking about earlier, that if you're exposed to a little bit of stress, you can bounce back and you can develop that resilience. But if you have never experienced certain levels of stress, and you experience those in later life without having developed a means of coping with them, you might struggle quite significantly later on. Alcohol. One of the things that happens, with alcohol is that it gives you that sort of temporary blunting of, the experience of, painful emotions. So what tends to happen is that people will use alcohol just to block out, the stressful emotions. So the sedative effect that alcohol has, and the blunting effect that it has from the intoxication, is something that people will find some temporary relief. So even some of the medication that you prescribe when people are going through stress, such as diazepam, which is a benzodiazepine, that will give you some temporary relief from the anxiety symptoms that you experience when you're going through an acute stress. Now, the difficulty with alcohol is one, it does have other impacts on the brain. So taken in excess will have a damaging effect on brain cells. And what tends to happen is that, you can develop a form of dementia from alcohol misuse, which can come on quite quickly. So it has got that negative impact, when taken in excess, when taken in for long periods of time. The other thing that alcohol will do is it will affect your liver's ability to regenerate. So some people who've taken chronic or alcohol for long periods of time will start to develop liver problems, and that will have an impact on them. Your metabolism is also affected with alcohol. So if you think about it, just one pint of beer, it's about 300 calories. Someone who's drinking in excess will probably drink up to about 6, 8, 10 pints of beer. That's about 3,000 calories, possibly in one sitting. So you'll find that a lot of people who are taking increased amounts of alcohol will start to put on weight. And with increased weight comes additional problems, such as, heart problems, such as diabetes, such as kidney problems, etc. So there are lots of problems with something that might give you temporary relief, but not necessarily give you lasting relief. Some people, because alcohol is a depressant, in fact, what alcohol does is actually just slow down the function of your brain cells. That might actually cause you to feel depressed. And it's quite funny. Well, some people might develop, a sort of hyperactivity after consuming large amounts of alcohol. Some people can actually feel quite tearful and low from just drinking alcohol. The after effects of that kind of post-intoxication phase, that temporary numbing of the pain comes back with a vengeance, and it causes you to want to drink more, and there's this negative cycle of you gradually becoming dependent on alcohol. So it's the same sort of phenomenon with illicit substances as well. It's quite interesting. I mean, some people don't know that when you do something like exercising, for instance, and you're feeling quite low, a period of exertion for about, you double your heart rate for about 30 minutes. What that actually does is to give you a burst of what are called endogenous morphins or endorphins, so which are chemical transmitters in the brain, which give you a feeling of euphoria or feeling good. So some of the kind of, without actually taking any substance, you might actually have, that impact, that positive impact on your mood and well-being, and that comes, without the cost of, those kind of deleterious effects on your body and all the systems of your body. Yeah, so there are a number of organizations which cater for specifically people of ethnic minority background, and there are some they come in various different forms. Some of them are from a kind of church-based function, for people who are non-religious. My advice would be to sort of contact the local GP, because a lot of the third sector organizations are linked in, through the general practitioner. And the other thing which you might be sort of noticing, there are kind of, symptoms of an emerging depression. And if she has a clinical assessment, that would also help. The number which I shared with you earlier, I don't know if you've managed to note that down, which is 0800 44 0828. That the mental health navigator, the person on the other end of the call, has got access to a number of different organizations which cater for people's individual needs. I personally, do not know what all of those things are, but in order for her to get something bespoke, if they could call that number, and sort of say, this is, the unique set of circumstances that they are going through, the mental health navigator will be able to signpost. It may actually be that that person might need secondary care support. They might need crisis support in that moment, in that time. There needs to be an assessment of, their risk of self-harm, etc. So all of those things need to be done so that we can offer a sort of more comprehensive package of care. But what the local mental health trust is doing is working with a lot of third sector partners now, who are specialized in various different things. So yes, you are right. Some organizations might be suitable for a certain demographic, but there will be other individuals who will need, ethnic minority support, and there are a number of organizations who are designed in that way, so that they can offer, people particularly of a BAME background the requisite support, which is culturally sensitive. Here's the interesting thing. Lithium is probably the one mood stabilizer, that is well known for the longest period of time in terms of, the practice of psychiatry. So as a mood stabilizer, the greatest level of evidence in terms of, its effectiveness. Lithium is, one of those. Sorry, someone is talking in the background. Do you want to just mute yourself? Okay, yeah, I've managed to mute them. So lithium does provide that, level of, clinical trial data that shows that it's a very effective mood stabilizer. That's the first thing I would say. Second thing I would say is that lithium has got something that's called a very narrow therapeutic window. Okay, so whenever you start prescribing lithium for someone, and this might be true of your relative, that you have to take blood tests, and you have to take kidney function tests on a regular basis, and you have to measure the levels of lithium. There's only a small window in which the medication is effective, and beyond that can cause a degree of toxicity. It can affect the way the kidneys work. That's one thing. It can also affect the way the thyroid hormone works. So some people, might develop a goiter from taking lithium, and that is something that one needs to keep an eye on. Some people will experience a metallic taste in their mouth, and some people will experience a general slowing down. But the thing I would say is that there's no medication which doesn't come with side effects, and often the balance that we need to strike is the impact of the mental health problem against the physical health problem. Lithium is not as popular as it used to be. There are other mood stabilizers out there, but I would be reluctant to go into detail about the individual treatment of someone in a public forum such as this one. But I would advise you to have a discussion with the consultants Muchi, you want to come in?
Yes, I do indeed. I'd like to know if there's anything called situational depression, and if there is, does this mean no matter how long the situation prolongs for, eventually when it ends, is this going to be an automatic switch from being depressed to just being normal, albeit the person is on medicational treatment?
So, what you're describing is something called an adjustment disorder. So, if you're going through an adverse, situation or event, that can have a massive impact on your mood. We see this a lot in people who are undergoing cancer treatment, for instance, or have got a friend or a relative, that's suffering from a long-term condition, or have experienced a period of loss. So, that term that you use, situational depression, it can be a grief reaction or an adjustment disorder. Some people will have a brief adjustment disorder, which will be just in response to that situation. And they may experience some of the symptoms that I described earlier, which are depressive symptoms, but those can lift, after. But if you sort of remember one of the things which I said earlier, which is that resilience is very variable, and it's also dependent on one's sort of early childhood experiences and a response to that, how well adjusted they are. So some people might be more susceptible to a much more prolonged, adjustment reaction. For some people, something like childbirth can be a traumatic event. So some people will have something called postnatal depression. And it's always odd in those situations where people are expecting them to be happy that they've got a child, but they actually have a very, very low mood. And they are, suffering. Maybe they've had a traumatic birth, or maybe they have just been shaken by that experience, and they find it difficult to come to terms, with their new reality. So that depends. There are many different factors leading to the spread of COVID-19. One of them is that the virus mutates, like most viruses. So once a virus has, once the body has developed a mechanism for fighting, the immune system has developed a mechanism for fighting a virus. What the virus tend to do is to have some genetic mutations, which alter their surface proteins, the spike proteins, the shape of it, to make it evade the immune system a little bit. Some mutations will lead to increased spread, and some mutations will lead to the old variants, dying out. And we've seen that with the Delta variant. When the Delta variant came in, it was a lot more infective. They call that more virulent, than previous variants, and it actually sort of wiped out even some of the previous variants through a kind of natural selection process. The truth of the matter is that there is an impact of not enough people being vaccinated. So that means that our ability to fight off those infection and to eradicate the disease is limited if we don't have a certain percentage of the population vaccinated. And they calculated that based on the reinfection rates of COVID, that we would need about 90% of the population vaccinated to be in a position where we can eradicate the virus. However, here's the other complication with that. That estimation was based on, alpha and beta variants, of COVID-19. And if it was like a light switch that we could vaccinate 90,000 people just like that in one day, then we would probably have a chance of eradicating that virus. But obviously, the virus is still out there. And the rates of being able to vaccinate people, even if you did it as quickly as possible, does not catch up to that. So if you've got circulating virus out there, then your previous estimation of the percentage of the population that you need to vaccinate, it keeps on changing. Hence why you need a third dose of the virus, of the vaccine, sorry, through a booster program. The other thing, which is, and I'm sorry if I sound like I'm, not being very optimistic about this. The other thing to remember is that our vaccines are different, and they've got different effectiveness rates. So your effectiveness of the Pfizer vaccine is different from the Moderna vaccine, which is different from the AstraZeneca vaccine. So you've got different types of vaccine which are out there with varying degrees of effectiveness, with varying mechanisms of how they give you that protection. So it's very difficult to say. What we have seen from the population studies, and this we can say for sure, is that vaccination does actually slow down the rate of transmission. So we've seen that. So when we've carried out our vaccination program, we've actually seen reduced. So if we look at how we choose who gets the vaccine, it's based on this what we call the number needed to vaccinate, and the aim of vaccination. And this is an interesting thing. The aim of vaccination, the main aim of vaccination, is to prevent death. So that's why we vaccinate people. There are certain people who will get COVID, and the percentage of those people who will get COVID because of their age and because of their immune systems and because of the lack of long-term conditions will be able to fight it off and survive. So we tend to prioritize first the people who would, if they were to contract COVID, die. Hence, Protima, we have that, situation where we select a certain group of people and say, we're going to prioritize those people for vaccination because we're trying to protect them of vulnerable people out there.